Hello and welcome to this video on therapeutic lying in dementia care. This video will explain the reasons why therapeutic lying is ethical and should be used as a form of person-centered communication in the care of people with dementia. In the past, people have reacted to the topic with alarm. Some of the common concerns and objections to lying have been: lying is unethical. It's against my personal beliefs. You shouldn't lie to a vulnerable person. You lose trust. It confuses the person, and it can be avoided. This video will address each of these concerns and explain how lying can be ethical practice. Let's start by talking about the general use of lying. Research shows that the average person lies 3 to 6 times every day. We justify these lies by renaming them as fibs, white lies, being economical with the truth, etc. Lying is something we do every day, and it's often for the benefit of other people. When we lie, we probably have a justification for doing it. First, let's clarify what's meant by a lie. A lie is any phrase or action that attempts to intentionally deceive. Blum outlined some types of lying which we have extended through research. Types of lying include outright lies, white lies, going along, not telling, tricking, or environmental manipulation. Outright lies are lies which are completely untrue and there is no likelihood it will come true. For example, please get up and dress because your family are visiting later, when the carer knows that this isn't true. A white lie is one that's perceived by the user to be a minor lie because they use qualifications or because it may be true at some point in the future. For example, go and sit down for a while. I think your favourite TV programme will be on soon. Going along is when you fail to correct a person's misperception of a situation. For example, I'm looking forward to seeing my wife later. Well, that'll be fun, when the carer knows that his wife has died. Not telling is missing out relevant information with the intention to manipulate their actions. For example, it's a nice day, let's go for a drive, when in reality the person is being taken to the dentist. Tricking is when a person creates confusion to make a person's behaviour more malleable. For example, speaking so quickly that they're not able to understand what's being communicated. Environmental manipulation is when the surroundings are altered in order to deceive. For example, painting the exit door the same colour as the wall to avoid exiting behaviours. Lies can form an important part of dementia care because of the cognitive difficulties experienced with the illness, which include memory problems causing time shifting and loss of insight. Time shifting occurs because people lose the ability to orientate themselves to their own timeline because their short-term memory has deteriorated. If they're not able to draw information from their situation from their short-term memory, they will make a guess based on their long-term memory. For example, Joe, an 80-year-old man living in care, wakes up from a nap and wonders why he's in an old people's home. Because his short-term memory is limited, he may conclude that he must be at work on a job. As he was a plumber, he sets about trying to fix a sink. This shows how Joe is time shifted to a different period in his life, and also that he lacks insight into his illness. He's living in a different reality to the people around him. If we're going to communicate with him in this different reality, we have 3 options. We can try and bring him into our reality, we can enter into his reality, which often leads to lies, or we can enforce neither, the sitting on the fence approach. From our intensive research into this area, we've found that entering their reality can be the most compassionate approach. Orientating to our reality by using calendars, photos, or newspapers to remind residents when and where they are can help them to engage in topical conversations. However, this can be frightening if what you're trying to reorientate them to doesn't make sense in their reality. It also may simply be forgotten about in just a few moments' time. Sitting on the fence, although a common option chosen, is unsustainable. The person with dementia, not being stupid, will pick up on the evasiveness and be suspicious about the strange way that you're answering their questions. Going along with a person's incorrect ideas or beliefs can be the kindest approach. Discussing the topic by immersing fully into their world gives us a full range of skills to validate, praise, and empathise with what's being discussed. For example, I spoke to my wife this morning. Did you have a good chat? Yes, she told me our son passed his exams. You must be proud. I bet he's clever like you. Did you know I was the first in my village to go to college? Tell me about it. Our research showed us that 95% of care home staff admit to lying, and that those providing more hands-on care lie the most, probably because they communicate with the residents more frequently. While we were concerned about the negatives of lying, we realised that lies were being used anyway, but in an unregulated fashion. We didn't want this to continue and felt we needed to bring the issue out into the open. In collaboration with care home staff and families, we produced a set of guidelines. They were not developed to support the use of lies, but to clarify the terms by which they could be used. The guidelines are: lies should only be told if they are in the best interests of the resident. Specific areas, such as medication compliance and aggressive behaviour, require individualised policies that are documented in the care plan. A clear definition of what constitutes a lie should be agreed within each setting. Mental capacity assessments should be done prior to the use of therapeutic lies. If an individual has mental capacity, then lies are unlikely to be used, although they may be able to make decisions about the use of lies in the future, for example if they become delirious. Communication with families is required, and their consent should be gained. Once a lie has been agreed, it must be used consistently across people and settings to prevent the confusion of different people telling different lies. All lies told should be documented, and the rationale for each lie should be explained and justified. An individualised, flexible approach should be adopted towards each case, and the cost versus benefit of each lie should be established. Staff should feel supported by families and management, and should not feel at risk for telling appropriate lies. Circumstances in which a lie should not be told should be outlined and documented for both the setting and each individual resident. The act of telling lies should not lead staff to disrespect the residents. They should be seen as a strategy to enhance their well-being rather than an infringement of their basic rights. Staff should receive training and supervision on the potential problems of lying and taught alternative strategies to use when lies are not appropriate. Clearly, this is a complex issue, and training is required to help staff recognise when and which lies are appropriate. In Newcastle, we've developed a training programme called Communication and Interaction Training, or CAIT. This training develops a range of dementia-focused communication skills, including therapeutic lies. In CAIT, lying is considered the last resort in a 4-step hierarchy. So if someone is making a difficult request, like asking to see their husband who has died, step 1 is to try and meet the need. Obviously, getting their husband is not possible, but the underlying need might be companionship, positive touch, or just someone to chat to. If this is unsuccessful, you move to step 2, substitute the need. For example, getting another family member to speak to the person, perhaps over the phone. If this doesn't help, step 3 is to distract. This is difficult when someone is highly emotional, so a lot of skill is required to capture a person's attention long enough to forget the need. This is when it's helpful when the carer knows the person really well, because the carer can enthusiastically try and engage the person in a topic of conversation that will shift their attention away from the need. If all of the above fails, this is the only time lying is justified. In this instance, you construct a lie that complies with the guidelines, is person-centred, and based on events from their life, so it's believable. A lie which does not fulfil these criteria could have terrible consequences. An example from our own ward was a lady who was told her husband had gone fishing, but he had never been fishing in his life. The only explanation she could think of for being lied to was that her husband was having an affair. It's sometimes argued that telling the truth in this situation would have been better, but if she gets upset every time she's told her husband has died, this could be highly traumatic. There are also instances where telling the truth can undermine trust. An example of this was a gentleman who was informed his wife had died, and he became really angry, telling the carer he'd been married for 55 years and that he would know if his wife had died. A final issue is that we're often asked why we insist on calling it a lie, as it's such a problematic word. Our response goes back to why we started all this research. We want to bring the issue out into the open, and the term grabs people's attention. I hope you can see how there are instances where therapeutic lying in dementia care can be not only ethical, but in fact the most appropriate communication tool to use in some circumstances. Discussing this topic allows us to regulate and guide practice which is happening anyway, and helps us to avoid the negative consequences of bad lying, and use it as a tool to enhance the well-being of residents. There are over 12 publications written about the use of therapeutic lies in dementia care. If you would like some more information about the findings, a copy of the guidelines, or information about our training, please contact Dr. Ian James at this email address. Thank you for listening.